I'm on, and this is my final biology project, Understanding Cholera. So, understanding cholera, I'll be presenting that the infectious disease known as cholera, which is also known by the bacterium Vitibrocholera. Cholera is also known as a waterborne disease, which is caused by outbreaks around the world for centuries. And in this presentation, I'll explain the biology of the organism, how it spreads, symptoms and treatments, outbreaks, and how they can prevent this disease. So cholera is a medical and common name for this disease. It is caused by a bacterium, Vitibrocholera, and this bacterium is also known for its common shape, curved, rod appearance, which is why it's categorized as a vitibro, and is a gram-negative organism, meaning it is thinner than a peptidoglycan layer and it stains pink during a gram stain test. Because cholera is caused by a bacterium, it falls under the bacterial infectious disease. Understanding its structure helps explain how easily it can multiply and spread in contaminated water sources. So vitibrocholera cholera thrives in environments where the water is warm, slightly salty, such as coastal areas and brackish rivers. It grows especially well in alkaline or high pH water. Bacteria also attaches to plankton and shellfish, which can help them survive between outbreaks. This multiplies quickly at temperatures between 20 to 37 degrees Celsius because the bacteria depends on the contamination of the water source. By human waste, poor sanitation greatly increases their ability to survive and spread. So cholera spreads through the fecal-oral route, meaning people become infected when they drink or eat something contaminated with feces containing the bacteria. The most common source is unsafe drinking water. Areas with poor sanitation, flooding, crowded living conditions, or limited access to clean water are at the highest risk. This includes developing countries, refugee camps, and regions affected by natural disasters. Although anybody can touch cholera, young children are especially vulnerable because they can become dehydrated more quickly. Cholera symptoms develop rapidly and become severe within hours. The most recognizable symptom is profuse watery diarrhea, sometimes described as rice water stool. Because it is pale, milky appearance, people may also experience vomiting, muscle cramps, and extreme dehydration. As the body loses water, blood pressure drops, and the circulatory system struggles to function. Without treatment, a person can go into shock, organ failure, and death. This disease mainly affects the digestive system, but the dehydration impacts the whole body. So, the diagnosis and testing. Cholera is also diagnosed through a stool example where the bacterium can grow and be identified in a laboratory. This is the gold standard test. In outbreak situation, rapidly diagnosis tests are often used because they give results quickly. Healthcare providers can also make a diagnosis based on symptoms, especially if a patient has watery diarrhea and dehydration while living or traveling from an area experiencing an outbreak. So the treatments. The most important treatment for cholera is rapid rehydration. Oral rehydration solutions, or ORS, can replace the fluids electrolytes lost through the dehydration or vomiting. In severe cases, IV fluids are necessary because dehydration can happen extremely fast. Antibiotics such as diclofenac and iso I don't know if I pronounce that, may be used to shorten how long the infection lasts, but they are not the main life-saving treatment. Children with cholera often receive zinc supplements, which can help reduce severity of dehydration, the duration of diarrhea. And step 2, the ORS is the main treatment, IV fluids for severe cases, and antibiotics to help shorten illnesses. And step 3, the ORS is the primary life-saving treatment. Fluids are for dehydration and shock, and then antibiotics to reduce the duration of bacterial shedding. So the risk factors in current outbreak. Many environmental and social factors increase the risk of cholera outbreaks. This includes contaminated drinking water, poor sewage systems, flooding, and crowded living conditions. According to the CDC, recent cholera outbreaks have been occurring in places such as Haiti, the Caribbean, and Yemen, which is natural disasters and humanitarian crises have disrupted clean water access. These outbreaks show how closely cholera is linked to sanitation and infrastructure. So vaccines and complications. Cholera is a medical and common name used for the disease, and it's the bacteria vertebrate cholera. This bacteria is known for its common shape as a rod appearance. I think I already read this. So for prevention, here are some more true and false questions. So cholera rehydration solutions is the most effective treatment for cholera. The answer is true. Cholera spreads through primarily through mosquito bites. That is false. Um, for the weaknesses, cholera can kill a person within hours if untreated. The answer is true. Only children can catch cholera. That's false. They're just more likely to catch it, or easier, or vulnerable to catch it. Um, um, Proper hand washing can prevent cholera. The answer is true. Um, Cholera vaccines offer lifelong protection. That's false. And cholera may affect the digestive system. The answer is true. Antibiotics alone can cure cholera without rehydration. That is false. And here's my references.